Using intravenous lock, I would prepare 2 syringes of 2 to 3 milliliters of normal saline, and if the agency requires, I would also prepare uh, a syringe of heparin with the amount required by the agency. And then to assess patency, I would scrub the hub and inject a small amount of saline. And I'm looking for infiltrate or a blockage or resistance, which could mean that there's a clot, or if the patient doesn't fear saline going through the vein. And then I'm also looking at possible phlebitis, such as redness, swelling, pain, or other complications. But if the line is patent, then I would inject the first syringe of saline after first using a new alcohol swab and scrubbing the hub, and I would inject uh, in a pulse-like fashion according to the institution policy, and then I would pull that one out and discard, and I would get another alcohol swab, scrub the hub again, and then I would inject the medication per the drug book direction as to the time frame to inject the medication. And then I would pull that syringe out and scrub the hub again, and then I'm injecting the third syringe of normal saline at the same rate that the medication was injected at. And then I would pull that syringe out, and then if heparin is required, I would scrub the hub again, and I would inject the heparin slowly, and then I'm observing the patient for any adverse reactions, and I'm recording the medication, the amount, and the route. And the time in the MAR and the INO record. And then, in order to remove the IV equipment, then because patients don't go home on IVs, I would need a doctor prescription to remove, and the supplies would be normal saline and gauze and tape and clean gloves. So I would do hand hygiene and put on the clean gloves, and then I would loosen the tape around the edge. I would shut off the drip for the IV, and then I'm going to have gauze at the ready, and I'm going to slowly, methodically remove the catheter from the vein. And I'm going to put gentle pressure for about 1 minute, but I'm going to monitor for bleeding and possibly be using more gauze. And also, if the patient is on Coumadin or blood thinners, I'm going to be putting pressure for longer duration of time also. And once the bleeding stops, I can put the Band-Aid on, and then some nursing interventions over the course of therapy to know where the patient stands as running labs such as the PTINR, and also monitoring for bleeding and signs of bleeding and hemorrhage that the patient may be experiencing.